just want to thank you guys for joining to speak a little bit about your experiences with the Faces Foundation and the Phil Award. Um, to begin, would you guys just introduce yourselves? Jenna?
Yeah, I'm Jenna McWilliams Seals. I am the 2020 recipient of the Phil Award for last year.
Darian Dardar. I'm the 2021 recipient for the Phil Award.
Wonderful. So you are the recipients for the past 2 years of the Phil Award. Could you explain a little bit about the Phil Award, what it is, and maybe how it's different from other types of recognition programs that exist within respiratory therapy departments? I'll start with you, Jenna.
Yeah, well, basically, I enjoy the Phil Award because it's specialized and centered around us therapists as a whole and everything that we do on a daily basis, whether it be the care that we give to our patients physically or the emotional support and care we give to the family members that we're caring for the loved ones of. And like the Daisy Award for nurses, it just shines a light on us as a department in whole or a career field in the whole aspect that this is what we do, this is what we specialize in, and this is what we take pride in every day. And so that's why I like it, because it showed that we care enough for our patients that others outside of our scope of practice recognize it, whether it be team members or family members of patients.
That makes sense. What about you, Darren?
I kind of agree with Jenna. Um, Nurses get a lot of recognition, but respiratory therapists is kind of like the background folks of the hospital. We do a lot, but we're not really recognized a lot. So the Phil Award is great because it's just nice to be recognized in the hospital and not just in the background.
No, that makes perfect sense and a good answer. Now, always interested to know about the story behind the award, specifically in your cases. And I'll start with you, Darian. Could you talk a little bit about how you were awarded the Phil, and specifically what the story was around it? Because we understand that these nominations come from people outside your department, actual patients or caregivers.
So I was told I was nominated by multiple people. One in particular was Dr. Famuidi of the neonatal intensive care unit, which she's the attending who is over the entire unit. So it was very special to know that she recognized that I do put my heart into everything I do here and I do my best for my patients. I know another nurse, she nominated me, and I was told a few patients nominated me. So it was nice that they recognized that I care a lot.
Absolutely. I mean, it must be great getting the recognition from your colleagues and also from patients.
Mhm.
What about you, Jenna?
I'm like Darian. I was nominated by multiples. A nurse from the pediatric ICU where I staff had nominated me, and also a parent from one of my patients out of the PI had nominated me. And just the nurse touched on the fact that anytime one of them calls, I'm there. I don't give any hesitation, that this is truly what I live for, these patients and their
Mhm.
families. And then the family member of the patient that had nominated me, it was along the lines of I cared for her child as if she were my own child and put in the time and the effort to make sure that her child felt comfortable, even whenever I could tell that she was uncomfortable. And that really just meant a lot to me, that the parent of the child saw how much I cared for her child like she was my own, and that I wanted to give the best care that I could give to her. And it feels good to know that people outside of our profession and outside of our little circle of respiratory therapists see
Mhm.
that we truly do care for these kids, and the care that we give them, we want it to be the best that it could be.
Absolutely. Um, when this award was given to you, was it a surprise? And also, how do you remember feeling when you received this award? Jenna?
Um, I kind of knew about it beforehand, but I didn't know when I was going to get it. So when I actually did get it, it was a surprise. And it just made me, I don't know, it's just one of those things where you don't realize how many people actually see what you do on a day-to-day basis until something like this is presented to you and people thank you for the work that you do. I didn't realize how many people actually stand back and watch everything that we do and notice everything that we care for and all that and appreciate it. So that was really nice.
I'm certain. What about you, Darian?
It was a surprise to me. Um, so I've only been a therapist for 2 years, so I did not expect to get this award at all. But it was a great feeling. Like I said, especially because Dr. Famuidi was one who nominated me. It really meant a lot because I really respect her. She's a great physician. So it was an awesome feeling, and I have the trophy in my living room,
Yes.
and I'm very proud of it.
That's awesome. And it is a beautiful trophy. I've seen it.
It is.
It's heavy too.
Is it heavy?
Oh, it's heavy.
It's really heavy.
Um, so, over the past 2 years, it's been a difficult one, especially for frontline healthcare workers like yourself in COVID. Um, how does winning this award help you validate, the decision that you made uh, just a few years ago, in Darren's case, and maybe a few years before that, in Jenna's case, to become a respiratory therapist? Darren, I'll ask you first.
I became a respiratory therapist because I decided I did not want to do nursing, and my mom was in the hospital with a trach, and I was trying to look at allied health professions other than nursing. And I seen respiratory therapists, and I was like, I remember the respiratory therapist coming in my mom's room all the time. And she was always there when we needed her, and she was great, and she was able to help my mom breathe better. So that's why I became a respiratory therapist.
Great. What about you, Jenna?
Well, I've been doing this for about 10 years now. And
Mhm.
the reason I got into it is because, like Darian, I decided nursing was not for me, but that I remembered that my mom, growing up, I would see her struggle with asthma and always having to have her inhaler with her or have a nebulizer ready for whenever she had a flare up or an attack or anything. And whenever I was looking at allied health professions and I saw the respiratory therapists and I looked more into it, I realized they specialize in the area that we specialize in. We are specialists in the lungs and the hearts. And if those two don't work together, then nothing else is going to work. And I really like the fact that we could be the base of the care that everybody else gives. Because if you're not breathing, not doing anything. So I
Yeah,
liked that. And that's what really set it out for me is that we could really give specialized, localized care instead of we're going to care for this, 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 and this. No, we're going to care for your breathing and we're going to make sure that you're breathing well no matter what the circumstances are. And I really enjoyed that aspect of it.
right. As they say, if you can't breathe, nothing else matters, right?
Right.
That's
That's
right.
right.
So, in general, with your colleagues in the respiratory department as a whole, how has this award been received and perceived within the large organization? Jenna?
We've gotten a lot of congratulations from people that I didn't even realize they knew that we had gotten the award. And even people, nurses or techs or x-ray people that have congratulated us that didn't know about the award, they have now been informed and educated on it. And once they read and saw what the award was based on, it was nice to hear that we too are the perfect candidates for that based on the description. And that really hit home and kind of made us feel warm and fuzzy inside.
Yes.
What about you, Darian, and specifically with amongst your respiratory therapy colleagues? How do they perceive just the award in general?
Like Jenna said, a lot of them congratulated me and they said it was well deserved. Um, so I think it's a very respected award, especially because it's only given once a year.
Besides you two as the specific recipients, are the people that you work with within the respiratory department, are they pretty positive about the award in general, that you have such an award within the respiratory department?
Yeah, They have, once we because this is our 3rd year doing it, but unfortunately due to COVID, we couldn't do it last year. But the first year that we got it, the first one of us that was, awarded it back in 2019 when we realized that this was something that was gonna be part of a recognition thing for the respiratory therapist in the hospital, we were all real excited
Mhm.
because we see nurses getting Daisy Awards or other specialized departments getting certain national awards, and it really, really touched home and felt great that there was one out there specifically for respiratory, and us as a department, myself and all my other respiratory colleagues really appreciated the fact that someone outside of our profession saw how much we do and how much we care and how much we put into this daily, that they wanted to recognize us nationally for an award for it. And that just really felt great when we first got it. And being a personal recipient of it now is just another amazing feeling. So, as a departmental whole, everybody is looking forward to seeing who's going to get it next year.
Great. Darren, anything to add there?
Not really. I think Jenna summed it up.
So, last, just asking you a little bit of plug because although there are many hospitals that have the Phil Award and are partners with the Faces Foundation, there are many others that aren't. And just for those uh, facilities that maybe have never heard of the Faces Foundation or the Phil Award before, or people that maybe have but they haven't taken any action, do you guys have any recommendations based on your experience about them bringing in the Faces Foundation and the Phil Award for their departments?
I mean, it's a great morale booster. It's
Mhm.
a great confidence builder. It's a great way to show that you respect your colleagues and your staff and what they do. And it's like Darian said, it's a once a year thing. So it's really coveted. And I think that bringing it into a hospital or facility that doesn't have it will show your therapist and your staff that you do see what they do on a day-to-day basis and you do respect it and that you want to show them how much you respect and appreciate everything they do and that this is just one way to do it instead of a pizza or a card or something here every now and then, a yearly award saying that for this year I recognize you and the hard work you do, whether it come from another colleague, a parent, a family member, whoever it is. It makes the person who's receiving the award really feel validated in their career choice and everything that we do daily.
Great.
Yeah,
Darian, anything to add?
yeah, I have to agree. It definitely was a confidence booster. Um, I feel like, I mean, the award, it just boosted my confidence. I feel like I can advocate better for my patients because now I know that I am respected within our unit and I am recognized within our unit. As before, I was a little hesitant on, I would advocate, but I was a little hesitant. But this definitely boosted my confidence and I will say has pushed me to be an even better therapist.
Excellent. Well, I really appreciate you guys' time. Before I close it out, are there any comments, anything that I haven't covered that you'd like to speak to regarding the Faces Foundation or the Phil Ward experience?
I'm just glad it's a thing. I'm glad that nationally respiratory therapists can be seen for what we really are, and that is the backbone of this hospital, and that we're there when everybody needs us, whenever anybody needs us.
Mhm.
And the award just goes to show that everybody, even though we don't feel like they do, people do see what we do and see how we contribute to the healthcare field. And even if it wasn't a national pandemic, that it was a respiratory virus and it was just a normal day that it was 3 years ago, we still do a lot to help support the medical team.
So I really appreciate you guys taking the time. Is there anything else that I missed that you guys wanted to say, or anything that you want to point out before we close this out?
I just wanted to say thank you to Mr. Phillips' wife for starting the foundation and recognizing us and just keeping it going.